It's one of those things that can happen in an instant, and it sends millions of people to the emergency room every year. Fainting. But what's actually going on in your body? Well, today we're going to pull back the curtain and decode the step-by-step investigation doctors launch the moment someone comes in and says, "I passed out."
You know, it's a truly frightening experience. 1 second you're standing there, totally fine, and the next you're waking up on the floor wondering what just happened. That sudden blackout, it's a signal, a mystery that needs to be solved. And for doctors in the ER, the investigation starts immediately.
So here's our game plan for this explainer. First, we'll figure out what this sudden blackout actually is. Then we'll put on our detective hats and gather some clues. After that, we'll line up the 4 main suspects, search for any dangerous red flags, and finally, figure out the safest path to sending someone home.
Okay, so before any investigation can really begin, doctors need to define exactly what happened. In the medical world, they call it TLOC, which stands for Transient Loss of Consciousness.
And this is maybe the most important thing to get your head around right at the start. TLOC isn't the diagnosis itself. It's the main clue that kicks off the entire mystery. Think of it as the symptom, not the underlying cause.
All right, so with that main clue identified, the real detective work begins. And you might be surprised to learn that the most powerful diagnostic tool in the ER isn't some million-dollar scanner.
Yeah, it's the story. Just getting a detailed, accurate account of exactly what happened is absolutely vital. What the patient, or even better, someone who saw it happen, can describe about the moments leading up to, during, and after the faint, well, that can often solve the whole case right then and there. So, what kind of clues are they looking for in that story? Well, they're digging into everything. Like, were you standing for a long time? Did you suddenly feel really hot or sweaty before it happened? Did anyone see your arms or legs jerking? How did you feel the moment you woke up? Were you confused? Every single answer is a crucial piece of the puzzle.
Once all the clues from the story have been gathered, it's time to line up the usual suspects. Generally speaking, the causes of this transient loss of consciousness fall into a few key categories.
The number 1 suspect, the one responsible for the vast majority of cases, is called syncope. It's just the medical term for when you faint because of a temporary drop in blood flow to your brain. Honestly, the best way to think of it is like a brief power outage in your brain. The lights just go out for a moment, and then they come right back on.
But here's where it gets really interesting. Syncope isn't just one single thing. As you can see here, it's kind of an umbrella term for 3 main culprits. You've got these reflex faints that are caused by a specific trigger, faints caused by a sudden change in posture, and then the most serious kind, faints that are caused by an underlying heart problem. So let's break those down.
First up is what's often called the simple faint. This is probably what most people think of when they hear about fainting. It's basically a reflex action. The sight of blood, intense pain, or even just straining too hard while coughing can trigger a sudden drop in your blood pressure and heart rate, and boom, you pass out.
Next on our list is orthostatic hypotension. You know that feeling when you stand up way too fast and the room kind of spins for a second? Well, this is the extreme version of that. When you stand up, gravity pulls blood down into your legs, and if your body can't compensate quickly enough, your blood pressure just plummets. This can happen if you're dehydrated because of certain medications or due to underlying conditions like diabetes.
And that brings us to the suspect that we take the most seriously, cardiac syncope. In this case, the faint is a direct result of the heart itself not pumping blood effectively. It could be an electrical problem, where the heart's beating way too fast or way too slow, or it could be a structural problem, like a faulty valve. This is the one we absolutely cannot afford to miss.
Now, a really critical part of this investigation is figuring out, was this a faint or was it a seizure? As this chart shows, the clues are very, very different. A simple faint often has a clear trigger, you feel it coming on, and you recover pretty quickly. A seizure, on the other hand, can strike out of the blue, often involves more intense body movements, and can leave you feeling confused for a long time afterward.
Okay, so we've met our main suspects. Now we move on to what is maybe the most critical phase of the entire investigation, the hunt for red flags. This is where doctors are actively searching for any signs of serious danger.
So here's the bottom line. While most faints are totally harmless, some are actually a warning shot for a life-threatening condition. These warning signs are what we call red flags, and finding even a single one of them changes absolutely everything.
And that is exactly why every single patient who faints gets an ECG, which is an electrical tracing of their heart. Doctors are meticulously scanning this readout, looking for hidden clues, things like abnormal rhythms or patterns that just scream, the problem is the heart. These electrical signatures are major red flags for a dangerous cardiac condition. But the red flags aren't just on the ECG. They're also in the patient's story and their physical exam. Did you faint while you were exercising? Has anyone in your family died suddenly at a young age? Does the doctor hear a heart murmur when they listen to your chest? Answering yes to any of these questions raises the stakes and means we need to act fast.
All right, so the detective work is pretty much done, the red flags have been checked for, now it's time for the final crucial step, creating a safe plan to move forward.
And this slide basically lays out the different paths we can take from here. If it's clearly a simple faint, the patient can go home with some education. If it's orthostatic, we manage the cause. If we suspect epilepsy, that's a referral to a neurologist. But, and this is the most important part, if there are any red flags or if the cause is still a total mystery, that patient needs to see a heart specialist, urgently, within 24 hours.
For the vast majority of people, the ones whose faint turns out not to be serious, the best medicine is actually knowledge. Understanding your triggers, learning how to avoid them, and just being reassured that you're going to be okay, that's the most important part of the treatment.
And finally, this has some really important real-world consequences, especially when it comes to driving. If you've had a simple faint, you can typically get back behind the wheel. But if you're waiting for that specialist assessment because of red flags or an unclear cause, you absolutely have to be told not to drive. It's a critical safety measure until a clear diagnosis is made.
So, when you really think about it, a faint is never just a random event, is it? It's a message from your body, a signal that demands to be decoded. And whether that message is just a harmless reflex or a critical warning, the job of the medical detective is to answer one simple question. What is your body trying to tell you?